part 2 of chapter 16. We're now moving on to the opposite side of diarrhea and treating constipation. So laxatives and cathartics. Laxatives promote the evacuation of the intestine and are used to treat constipation. Included in the laxative category are the cathartics or purgatives, promote rapid evacuation of the intestine and alteration of stool consistency. There are 7 different types, so it can be divided into 7 different categories. Bulk forming laxatives, stool softeners, emollients, saline laxatives, stimulant laxatives, osmotic laxatives, and chloride channel activators. So let's talk about bulk forming laxatives. These are your fiber supplements. They take a few days to work, however they soften the stool by absorbing water and increasing fecal mass to facilitate defecation. So fiber attracts water into the lumen of the intestine, builds up, and then because there's a bigger product, the intestine then starts to squeeze to get that product to move through. They are the treatment of choice for simple constipation, unrelieved by natural methods. You can find them in powders, capsules, tablets, or wafers, and usually they must be dissolved or diluted before taking. They work within 12 to 72 hours, so if someone's in a lot of pain from constipation, this might not be the option, because it can increase the feeling of abdominal distension. If someone also has a partial bowel obstruction, we may want to avoid these as well. Moving on to stool softeners. Docusate is the example here. They're surface-acting agents that moisten stool through a detergent action and are administered orally. They work again in 12 to 72 hours, and usually they're used a lot in post-operative patients or for pregnant women with hard, dry stools. Side effects are rare, with occasional mild GI cramping or rash. And prolonged use more than a week without medical supervision can be a problem. Emollients. Emollients promote stool movement through the intestines by softening and coating the stool. Think of it as like a fatty substance that sort of coats the stool and greases it right through the intestine. It can be administered orally, and usually it's effective in 6 to 8 hours, so it works quicker than what we've discussed so far. It can also be administered as an enema. Side effects can include seepage of oil from the rectum, which can cause anal irritation, malabsorption of the fat-soluble vitamins, because emollients are fat-based, and if we take a vitamin along at the same time, because they're fat-soluble, these vitamins are dissolved in the oil that we've given and can't be absorbed into the intestine. We wouldn't usually give these to children under 5 years old, debilitated or bedridden patients, patients with dysphagia, gastric tension, or hiatal hernia. We wouldn't give these to a pregnant patient, and we certainly wouldn't want to use them for a long period of time. At some point, we want the GI tract to return to its normal function. If somebody relies on constipation agents all the time, their GI tract can't function on its own without those agents, so it becomes reliant or dependent. Saline laxatives, such as milk of magnesia or magnesium citrate, promote secretion of the water into the intestinal lumen and should be taken only infrequently in single doses. Usually they work in a half hour to 3 hours, again, very quick. Side effects can include electrolyte imbalance, CNS symptoms, edema, cardiac, renal, and hepatic complications. Extreme caution with these. Stimulant laxatives such as Senna or Bisacodyl are cathartic in action, meaning they're going to work extremely quick. As you can see, 1/4 hour to 8 hours, depending on the preparation. Their use should be confined to conditions in which rapid, thorough emptying of the bowel is required, such as before surgery or endoscopy. Or if somebody has extreme abdominal discomfort and really needs to go to the bathroom. Side effects can include, again, abdominal discomfort, so use your judgment there. Loss of normal bowel function with prolonged use, electrolyte disturbances and dehydration with prolonged use, as well as discoloration of the urine with Senna. Osmotic laxatives, glycerin, lactulose, polyethylene glycol, etc. Draw water from the tissue into the feces, when that reflexively stimulates defecation. They usually work within 24 to 48 hours. Side effects are minor and include nausea, vomiting, gas, and cramps. They're also used to treat encephalopathy because they pull water from tissues, so encephalopathy means swelling in the brain and nervous system, and that can happen in hepatic failure, which is where we might see lactulose used pretty often. Chloride channel activators. This is a newer class of medication. Lubiprostone is a unique oral agent for the treatment of constipation. It increases intestinal fluid secretion by activating specific chloride channels in the intestinal epithelium. So therefore, it promotes regular bowel movements without altering electrolyte balance or producing tolerance. Usually it works within 24 hours. We try to reserve this as a last-ditch effort when other things aren't working. Moving on to antiemetics, which will close up this chapter, and the antiemetics meaning stopping you from throwing up. Prevention or treatment of nausea, vomiting, vertigo, or motion sickness. There's a lot of different agents available. Prevention is preferred over treatment. We would rather somebody not be throwing up if we can help it. Anticholinergics. Motion sickness is mediated by cholinergic and histaminic receptors in the inner ear, so naturally it would be treated by anticholinergics. Some examples: dimenhydrinate, scopolamine. There's a patch that can be used behind the ear. Dramamine, meclizine are all some examples, so read over that section. Antidopaminergics. Dopamine receptors are found in the chemoreceptor trigger zone, which is in the brain, and that zone influences nausea and vomiting. So if we can use a drug to affect that area, we're likely to cut down on nausea and vomiting and block messages to the GI tract, which causes that problem. Prochlorperazine is commonly used, promethazine really commonly used, and they're used for symptomatic relief. Their use is usually supplemented with putting fluids and electrolytes back into the body to prevent dehydration. They're also used pre- and post-operatively to prevent nausea and vomiting as well, so those you'll see commonly used in the hospital. Serotonin receptor antagonists. Serotonin is a major neurotransmitter involved in emesis, located in the gut. Serotonin receptor antagonists preferentially block serotonin receptors found in that same zone, the CTZ, as well as peripherally in the intestines to control emesis. So if that sounded confusing, it sounded confusing to me. Hopefully it didn't sound too confusing to you. There's serotonin receptors in the brain, in that zone, as well as in the gut, and both of those can be blocked to help control nausea and vomiting. The most commonly used ones are ondansetron and dolasetron. Ondansetron is so commonly used, I feel like we see it on almost every single patient in the hospital. It can be used to treat chemotherapy-induced nausea and vomiting, as well as post-operative nausea and vomiting. Side effects include confusion, anxiety, restlessness, sedation, drowsiness, etc., as well as some dry mouth, extrapyramidal reactions, especially in children and older adults. That covers this chapter. I'm not a huge fan of this book. It kind of jumps around a lot, and it doesn't necessarily tell you that serotonin receptor antagonists such as ondansetron and dolasetron aren't the only ones in the class. They're just a couple in the class. So when you see a drug that sounds similar to that, keep in mind it could be related. Look it up, see how it acts, see what its mechanism of action is, and try not to get too bogged down in all this information. I hope that helps you out with GI drugs. As always, feel free to email me with any questions.